Okay, thank you very much. Our next speaker is Tanja Pless-Muloli, and she's going to speak to us about preparing for the healing of war trauma in Syria. Tanja came from the UK from her native Germany in 1992. She's built a successful career in environmental public health in Newcastle University, and she's focusing on the health of people living in the industry and linkages between pollution, poverty and the environment and health. So we'd like to welcome Tanja to speak to us today on preparing for the healing of war trauma in Syria, thoughts from a psychotherapy, public health and autobiographical standpoint.
One is for dance. You scroll from, okay. Okay, so next slide, please. Next slide. Okay. Thank you very much indeed for letting me present this paper here. And I'm so pleased to see mental health so well recognized as part of NCDs within RESCAP-MED, with 4 of the 15 short presentations explicitly addressing aspects of the topic. I'm coming to this with 25 years of experience as an academic in public health, and as was said there, with a special interest in environment and health. But in the last 5 years, I've gained experience as a psychotherapist as well. And I took early retirement from Newcastle University in 2013. What I want to do here is address the topic from 3 standpoints towards trauma, from an autobiographical standpoint, from public health and psychotherapy. And I also want to talk briefly about 2 documents that address the topic, one UNHCR and one a WHO report. And I want to look at the challenges that are ahead for thinking about planning for looking at mental health, and what the domains are that I think require coordinated efforts. So I'm starting with an autobiographical standpoint, and that is me in 1958. I was born in 1955 in Germany as a first of 3 children for my mom and third of 5 children of my dad. And in 1958, my mom and my dad and my maternal grandmother, we moved into this newly built home that you can see here in the background. That was made possible to my family because both my mother and grandmother had been bombed out during the Second World War and lost everything. So they were entitled to a special mortgage that enabled them to purchase this home. My mom and dad had then met in the local newspaper office in Lüneburg, which is the town there. It's a town of about 50,000 people, where my dad found a job after the war in 1946, and my mom as well. And my dad had been a reconnaissance pilot during the war, so he had been in active service. I cannot remember any conversations that touched on war experience until much, much later, until I was much older. But I remember that my grandmother was very, very scared of firecrackers, which we used to use at New Year's Eve celebrations. So on many levels, I had a very happy childhood. It was safe, it was protected, I had good access to education and material well-being. However, due to the war trauma of my parents, neither of them was available emotionally. I used Peter Levine's quote, that you have in front of you, and I repeat it here. Much of the violence that plagues humanity is a direct or indirect result of unresolved trauma that is acted out in repeated unsuccessful attempts to re-establish a sense of empowerment. And Peter Levine describes trauma as a fact of life and stresses that we as humans have an innate capacity to heal our trauma as well. And just listening to that quote again now in the light of Rita's talk in the morning, I think there's a lot of truth in that. Moving to the first part of the psychotherapeutic standpoint, I want to say that with now not knowing it themselves, my parents were emotionally frozen. Such frozenness was very common in Germany at the time and was supported by the beliefs in society which focused on building the country and the family's material wealth, whilst creating a collective silence. And again, this is what Rita said this morning. I'm convinced that had my parents ever come anywhere near any of the diagnostic tools that are now used to identify post-traumatic stress, they would have scored very highly. PTSD, as we now know it, was invented as an anxiety disorder in 1980, and I think this context is incredibly important, for the third edition of the American Psychiatric Association Diagnostics and Statistical Manual of Mental Health, or DSM. 1980 was 5 years after the end of the Vietnam War, when the returning soldiers were exhibiting symptoms in the US. And having a DSM diagnosis of PTSD meant they were eligible to access services under the American healthcare system. The PTSD symptoms include hyperarousal, re-experiencing or intrusion, and avoidance or emotional numbing. But as a second point of looking at the psychotherapy standpoint, I want to go back into history. And I want to talk about the Epic of Gilgamesh, which was written not far from here in Mesopotamia, around 2100 BC, as one of the earliest records of mankind that are written down. So this was at a time when body and mind were still seen as inextricably linked, and the clay tablets told about the Babylonian king's distress after the death of his friend Enkidu. And the symptoms of suffering were described in this as sleeplessness, and we heard about sleep as an indicator of well-being this morning, terrifying memories, anger, and a sense of foreboding for the future. The Cartesian split of body and mind took root in the Western philosophy in about the 17th century, so with Descartes. This was the philosophical framework in which accounts of shell shock during World War I and II were made, and in 1980, PTSD. So DSM treated PTSD as timeless, as universal, and as cross-culturally valid. Descartes' body-mind duality was finally challenged in 1994 when the neuroscientist Antonio Damasio wrote a book called Descartes' Error, Emotion, Reason, and the Human Brain. And Jacques Panksepp argued that I think, therefore I am should be superseded by I feel, therefore I am. So I go with the view that PTSD is not a pathology that needs to be managed, suppressed, or adjusted, but that it's a result of a natural process that's gone away. The second psychotherapeutical framework of ideas that I want to introduce is attachment theory. One of the fathers of attachment theory is John Bowlby, a UK physician who was born in 1907. He observed the consequences of children being forcibly separated from their families due to evacuation from cities during World War II and through the Kindertransport of Jewish children from Germany to the UK. He concluded that humans are born with a set of behaviors which he called attachment behaviors, which provide protection from threat and promote safety. He also claimed that attachment is alive during the entire lifespan. With the more recent methods of magnetic resonance imagery, this process that was first described by Bowlby has been made visible and received another name. It's now also called neuroplasticity. From a psychotherapy perspective, healing of trauma has to happen in the relationship between a therapist or trusted other and a client, recreating the secure base that has been lost. However, it's not required to dredge up old memories and to relive the emotional pain. Moving to the public health standpoint, I've chosen this 2013 paper by Arthur Kleinman and Ann Becker, and again I was so happy to see Rita mention Arthur Kleinman's name. They outline the unmet need and unacceptable toll of human suffering for mental health, that is even without conflict situations. Kleinman is a psychiatrist and anthropologist, and he's a pioneer of transcultural psychology and wrote a book entitled Patients and Healers in the Context of Culture as early as 1981. This paper is an example of how the use of standardized reporting criteria, and that links to the previous presentation, in this case it's DALIs and the global burden of disease, brought out the magnitude of the burden of mental health. They argue that the game-changing potential of these empirical data increase investment to increase investments in mental health in proportion to the size of the problem has not been realized. They also highlighted the acute shortage of clinicians, especially in low and middle-income countries, and the need to train both specialists and non-specialists to deliver interventions. I want to argue here that in contrast to the universality of suffering, emotion, and attachment, the methods to restore balance and health of individuals and communities are not universal, but they are embedded within their cultures. And by culture, I mean a set of core features that include history and tradition and regulation of civil society, artifacts of art and literature, so that there's shared assumptions where people can predict each other's action given a given situation. I want to argue that in order to shape trauma treatment for Syrian refugees, and that includes Libyans and Palestinians and others in the region, that it will help to acknowledge that the current mental health burden, as well as PTSD, as they exist, each one is the product of their own cultures and histories and needs to be understood in that context as a starting point.
You have 3 minutes remaining. Mm-hmm.
The UNHCR report from last year reports the levels of services that are available, and I think it's a brave attempt to do this. However, I think it runs the risk of aligning activity to a medical model of disease and care. And I think that is a risk that is very apparent at the moment. And the same applies to the WHO document, which last year recommended cognitive behavior therapy and eye movement desensitization along with medication. And I think I feel sad that that is the case at this time. And to close, I want to give an example of long-term healing of war trauma, which I came across earlier this year in Cambodia, which further illustrates the point about the need for cultural embeddedness. And I don't know whether you can see that. That's me on the right there. The Fari, this Cambodian circus, was formed 20 years ago by 9 children and their art teacher after they returned home from a refugee camp after the fall of the Khmer Rouge regime in Cambodia. They were survivors of war and child soldiers. Today, more than 1,200 pupils attend a public school, learning artistic skills alongside math, science, and language. And I think this is an example of how cultural embeddedness can help to design forms of trauma healing that are appropriate for the context. And I will just close with this slide and point you to the suggestions I'm making for the further planning, which are in the abstract in your abstract book. Thank you.
Thank you very much. Thank you, Tanja. In the interest of time, we're going to move on to the next speaker, and then we're going to take questions at the end of the two presentations.